Treatments for heart attacks are improving, but we can do better. We all know that heart attacks are life-threatening emergencies, but they can also set off a long-term series of changes that reduces the heart's ability to pump blood to the rest of the body. Eventually, this process can lead to heart failure, and 38% of all heart transplants in the world are necessitated by heart attacks and these subsequent changes. Currently, we treat heart attacks by restoring blood flow to damaged muscle and also by giving our patients medication. But neither of these therapies directly address the underlying issue, which is cardiac scarring. After a heart attack, rather than try to repair the damaged muscle, the heart replaces it with scar tissue that doesn't have any meaningful pumping function. My thesis focuses on developing new therapies to enhance the heart's own ability to heal itself. So rather than excessive scarring, we have adaptive healing. Our group uses biomaterials to achieve these goals, and we have two main approaches. The first is taking a biomaterial patch and sewing it over a damaged area of the heart after a heart attack, and this can be done during open heart surgery. We also have another approach because not all patients need open heart surgery. Instead, we take a biomaterial powder and inject it into the pericardial space which surrounds and houses the heart. We found that biomaterials, when used in both of these approaches, can enhance cardiac healing and improve the healing effects of the cells of the heart that are involved. We found that the biomaterials specifically target the cardiac fibroblast. It's not a well-advertised cell, but it makes up 45% of all cells in the heart and is the main culprit for cardiac scarring. The biomaterials reduce the fibroblast scar activity and instead increase the reparative activity of these cells. These cells now become able to help with the formation of new blood vessels, and they also attract other cells to the area that can enhance cardiac healing. And overall, through these fibroblast-related mechanisms, the biomaterials can enhance cardiac function after a heart attack. Not only are we learning that these biomaterials can enhance cardiac function, but we're also learning how. It seems that there are certain components that can enhance the reparative activity of fibroblasts, and there are other specific components that reduce the scarring activity. And with this knowledge, we hope to one day develop our own biomaterials to help with cardiac healing after a heart attack. Now, looking at the bigger picture, the reason we're developing the patch and the injection methods are to provide clinicians with a large toolbox so that they can address heart attacks in multiple different scenarios. And scarring is not unique to just heart attacks and happens in many other cardiac and non-cardiac diseases. So we hope that the knowledge from my thesis can be applied to a wide patient population and enhance patient well-being within and beyond the cardiac sciences. Thank you all very much for your time.